If you have varicose veins but you have no symptoms or signs and you're not really bothered about how it looks, you may be wondering how long you have before you need to get it treated, or even if you do need to get this treated. Now, there was a study that was done with 1,500 patients and they followed them over a period of 13 years. They got left with about 880 patients, which is still quite a lot considering 13 years is a long time. And what they found was that in 98% of those patients, their varicose veins progressively worsened. And more importantly, if they had no symptoms, they found 31% of those patients ended up having symptoms and signs by the end of those 13 years. Now, it's very hard to predict exactly how quickly your varicose veins are going to worsen. I wish I had a crystal ball and I could basically tell you that it's going to worsen in a set amount of time, but it's often very hard to tell. But one quick or easy way to essentially gauge whether it's going to worsen quicker or a lot slower is that if you develop varicose veins a lot earlier, in your early 20s or even 30s, the chances are in a period of 10 years you will develop symptoms and signs, and it's always best to get it treated earlier rather than waiting, because oftentimes the recovery is a lot easier, as well as the complications setting in and the ability to reverse these complications is a lot better.